Welcome to AETCM, the emergency medicine channel. Today, as a part of EM Rapid, we are going to discuss about the drug Dobutamine. So, Dobutamine is a synthetic drug which is a synthetic dopaminic analog. So, which is used for shock. So, the drug Dobutamine is a potent inotropic drug, means it increases the contractility of the heart, and also it has mild vasodilatory and chronotropic effects. So, where the Dobutamine acts is like that, it increases the contractility and heart rate of the patients with neutral effect or possible decrease in BP and very less chances of hypertension. So, herein the action is through various receptors. The action is through receptors like beta 1, beta 2 and alpha 1. The main action of Dobutamine is on beta 1 receptor, wherein which it increases the contractility. So, indication for the use of Dobutamine. Dobutamine is mainly used for cardiogenic shock, and wherein which because of this inotropic and chronotropic effect, it increases the contractility and thereby it increases the stroke volume and heart rate, and also decreases due to vasodilatory effect. It decreases the systemic vascular resistance, and therein which these three things which will go on to improve the cardiac output. So, other than that, it is also used for persistent hypotension cases, wherein which despite adequate fluid resuscitation and also along with the use of other vasopressor agents, also the patient is not improving with the BP. Patient's BP is not improving, and also it is used in late stage of heart failure. So, cardiac output and cardiogenic shock, late stage cardiac failure, and also in persistent hypertension cases. Pharmacokinetics. Coming to metabolism, metabolism is mainly through the hepatocytes and also in tissues, and excreted through urine, and half-life is like 2 minutes, and peak action is seen by 10 to 20 minutes, and onset is seen within 10 minutes. So, dosage. So, in our hospital we are getting Dobutamine in an ampule which is like 5 ml, which contains 250 mg of Dobutamine, and the Dobutamine is given at a dosage of 2 to 28 microgram per kg per minute, and this 5 ml ampule is constituted with 45 ml of NS, and this is given according to the dose. And coming to the side effect, main side effects of Dobutamine is like as it is having chronotropic and inotropic activity, it increases the heart rate, and sometimes can also increase the BP, and also it is having some nausea and vomiting, palpitation, ectopics, and also shortness of breath. Other than that, the adverse effect of the Dobutamine is like can precipitate asthma attack, ventricular ectopics can be there, and hypotension as well as anaphylaxis can also occur. So, the main difference is like most of us confuse between Dobutamine and dopamine. We will discuss and differentiate between Dobutamine and dopamine. So, Dobutamine as I already told is a synthetic catecholamine, whereas dopamine is a natural catecholamine. And mechanism of action for Dobutamine is purely adrenergic, like beta 1, beta 2 and alpha 1, whereas mechanism for dopamine is can have adrenergic action, dopaminergic action. It occurs through the various dosage ranges. So, effect of BP is it will be increased in case of dopamine, whereas BP can have neutral effect or increase or decrease in case of Dobutamine. And pulmonary capillary wedge pressure is reduced in case of Dobutamine. And in renal flow, dopamine improvises at lower doses, whereas there is no active action for Dobutamine, renal blood flow. And there is in case of Dobutamine, arrhythmogenicity is more when comparing to dopamine. And the next one is the inotropic action is more for Dobutamine and less for dopamine. And the indications, like as already told, the indication mostly it's dopamine is used for shock and renal failure, whereas dobutamine is used for cardiac failure and LVF, left ventricular failure. So that is the nutshell for dobutamine. Dobutamine is a synthetic analog which can be used for cardiogenic shock as well as persistent hypotension cases, and it's like given for 2 to 28 microgram per kilogram per minute. That's it for the short session for dobutamine. Thank you.